Today, I'm very fortunate to talk about advances at ASCO in the rare mutation types in non-small cell lung cancer. The common definition is patients without an EGFR alpha ROS1 mutation. Each of these alterations occur about 1 or 2% of patients, but collectively they make a substantial patient population. I think at ASCO this year, there's a lot of interest in RET rearrangements and RET mutations. These occur in non-small cell lung cancer as well as thyroid cancer. And the RET mutations are very common in medullary thyroid cancer. A drug called LOXO-292 was investigated, showed a very high response rate with really minimal grade 3 or 4 toxicities, and it also had some activity in patients with brain metastasis. I think that this is going to be a tremendous advance for our patients with this molecular alteration because it's much more tolerable and active than our currently available drugs. The next group that I'd like to focus on today is the HER2 mutations. Between last year's ASCO and this year's ASCO, there's been a lot of interest in developing drugs for this patient population. It's about 1 or 3% of the adenocarcinoma non-small cell lung cancers. TDM1 has shown activity in this group of patients, and I think that promising results need to be followed up on. In addition, there's some studies looking at tyrosine kinase inhibitors that hit this very specific mutation. Very preliminary results were presented at ASCO, but I think these need to be followed up on. The last group of patients with rare mutations that I'd like to focus on is the MET exon 14 or MET amplified. And this is sort of two molecular definitions, but our currently available drug, crizotinib, has shown activity with a good response rate and good disease control. However, I think there's a need to improve upon the activity of crizotinib, and there are some preliminary studies looking at new agents targeting this subset of patients.